Welcome back to The Woman Factor. Heart disease is the #1 killer of women, causing 1 in 3 deaths each year. Today on The Woman Factor, we will be discussing how women can take steps to understand their unique symptoms of heart disease and ways to reduce their chances of developing heart disease. We are joined by Dr. Peter Fail, Interventional Cardiologist at the Cardiovascular Institute of the South, and TGMC patients who experience heart complications, Kim Waldrup and Jeanne Caldarera. Thank you all for being with us here tonight on the show.
Thank you.
So Dr. Peter Fail, we will start with you. Can you tell us a little bit about heart disease and how it affects women?
Well, one of the interesting things about heart disease in women probably has more to do with the lack of awareness. If you look at the number of women each year that experience a heart attack, and you said in your introduction, 1 in 3 women will die of heart disease, probably in the neighborhood of about 44 million people, or 44 million women in the United States currently have some form of heart disease, everywhere from experience an infarction or a heart attack in itself, or have high blood pressure or cholesterol. Women typically present in different phases or different types of presentation to the ER with heart disease themselves.
Mm-hmm. And moving on to Kim and Jeanne, how do you feel after hearing those stats? Were you aware of the severity of heart disease before you were diagnosed? Kim, we'll start with you.
Well, yes, I was aware. I knew it was something very serious, and hearing those stats is sobering. And it's even more sobering when you realize that you have become one of those statistics. But like a lot of people, I thought that just happened to someone else. It wasn't going to affect me.
Right.
And I think that's the mindset of a lot of people.
Right, we all think we're all fine, and then until it hits you, until it happens to you, It's like, what? And Ms. Jeanne, what about you? How do you feel after hearing those stats, and were you aware of the severity of heart disease?
Probably not, but I also was arrogant enough to think that it didn't apply to me because I exercised, I ate well, whatever. I had low cholesterol, low blood pressure, nothing, nothing that would seem to put me at risk. So I really was arrogant enough to think that it didn't apply to me.
And so, Dr. Peter Fail, what are the symptoms of heart disease in women specifically?
Well, women tend to present, a couple of things. So women tend to present, they can have the typical scenario of chest discomfort and shortness of breath. They tend to be more emotionally driven than exertionally driven. Saying that, however, that there's a huge number of women that present silently, if you will, that we see them in the emergency room for fatigue or for weakness, and come to find out that they've had a heart attack or having a heart attack. So they don't present with the typical heavy chest that men would do.
And speaking about these symptoms of heart attack, heart failure, talk about maybe the signs and symptoms. You've mentioned the arrhythmia or stroke. And I know you mentioned can experience angina, which is
angina.
Correct, angina. Okay.
No, angina.
Angina. Okay.
No, Gina.
Got it. Okay. Got it. Can you explain a little bit more about that in particular?
Well, there is a syndrome called Syndrome X, which is specifically seen in women. It's a microvascular circulation where when you do an angiogram on women, their macro vessels, the big arteries, are open, yet they have microvascular, the tiny vessels, and they experience the exact same syndrome. They'll have chest discomfort, they'll have shortness of breath, they will have heart failure. And that's a totally different scenario for women. It's more prevalent in women than it is in men.
And moving on to Kim and Jeanne. Kim, did you experience any of these symptoms beforehand?
Yes, I started having symptoms 2 weeks prior to my heart attack. My biggest symptom was a constricting pain in my left shoulder blade, and that pain would sometimes go up into my neck, in the base of my head. I had pain on the upper portion of my left arm and numbness on the lower portion. And I would get this tightness just below my neck from shoulder to shoulder. And then occasionally I would get jaw pain along the left edge of my jaw that would go up into my ear. And these symptoms persisted. But even though I knew the symptoms of a heart attack, I also had had a previous shoulder and neck injury, so I blamed all of these symptoms on that old injury. And so I just didn't put the pieces together, and I didn't make the connection. And I think the biggest reason that I didn't make the connection was because I had no chest pain. In the 2 weeks prior, nothing, not at all, not the first pain. And I think if I had had some chest pain, I would have recognized it as heart-related, but unfortunately I didn't. But I think Dr. Fail is going to elaborate on some of the factors why this happens to women.
And John, what about you? What were some symptoms you experienced?
Probably none.
Really?
But I think it's interesting that Dr. Fail said that women are more emotionally driven. I had my, well, it wasn't, I had my plaque rupture. I never had a heart attack. I had it the day after Christmas, or probably Christmas. All right, so, but in October, my mother had died. My brother-in-law died 3 weeks later. My son told us that he was engaged. I was in a play that, you know, so I mean, I had a lot going on. And the first time I felt anything was Christmas Eve at a party that was at my house. And a political discussion ensued. And I remember going outside to throw garbage, and I remember thinking, oh, and I just felt a very, very minor tension in my chest for about 3 seconds. That was it. That was the only thing I felt, but it was unusual. So I knew that women presented unusually, so I just kind of kept that in the back of my mind too. So other than that, I had nothing.
Wow. Interesting. And Dr. Fail, why are heart disease symptoms in women usually more subtle than men?
You know, I'm not sure that they're more subtle. I just think they're different. And I think that, you know, the classic, you know, if you look at the commercial about the man who's grabbing his chest and he grabs a nitroglycerin to alleviate the symptoms, I think we kind of expect that's what we should have, and everybody should have the same thing. I think saying that, though, women tend to have more indigestion, or as Kim had pointed out, she had shoulder pain and back pain, and she had pointed out one very thing, tightness. And so there's certain words that people say that sort of get people's attention, and physicians and cardiologists' attention. Tightness seems to be one of them. So when people talk about chest tightness, that bothers me a little bit more than chest pain, because people say, oh, I feel like a stabbing pain. That doesn't mean it's not heart, but it tends to give you a little bit more moment for pause that maybe this really is something I need to be concerned about. And so tightness is something that she had mentioned, especially across the upper chest and radiating to her jaw. These are fairly classic scenarios that we'll see. And it really is a matter of just understanding. Like, you know, Kim said, I blamed it on my shoulder, and I thought I had shoulder surgery, and that's what that was. But there's certain things that sometimes you say, yeah, maybe this is more than just shoulder surgery. And you know, with shoulder surgery, it should get worse when you move it. It shouldn't get better, and if it stays the same or gets worse, then it's probably heart-related.
Now, which factors put women at higher risk of developing heart disease?
Well, probably a few things. Number one, you know, there's no factor per se that says women are notoriously worse. So the things that we look at, however, are low good cholesterol, for instance, seems to be a bigger marker for women than in men. Blood pressure is an issue. Probably late presentation. I mean, I think that's really the biggest caveat at all of this, is that the lack of awareness, or even at the medical level, at the professional level for physicians, sometimes the lack of awareness in understanding the symptoms. I think a lot of us would love to have somebody come in and says, I have chest pressure, it's like an elephant sitting on my chest, and you say, well, I know what you got. But women do present differently, and sometimes just that is the woman who comes to the ER and says, my shoulder hurts, and gets seen, and you know, you look at the EKG and it's normal, and you don't see anything, and say, well, it's your shoulder, and go home. And then they come back with a heart attack days later. And so a lot of times, you know, retrospectively going back and saying, well, that probably was the original presentation was probably related to your heart, and we just misunderstood the cues that you were telling us.
Well, definitely a lot of informative information. Thank you for all that. We need to take a quick break, but we'll be right back. Don't go away. We'll be right back after these messages from our sponsors.